Hi, I'm Dr. Akana, and today we're going to be learning about the angiotensin receptor blockers, or also known as the ARBs. So let's learn the ARBs by using the acronym NURSE MOD. And N stands for the name of drug, but what I like to do, I like to include the drug class in this section. And then if you need to know how the drug is formulated or how it's supplied, you can easily add that here. So the ARBs are renin-angiotensin-aldosterone inhibitors. And drugs that belong to this class include candesartan, irbesartan, losartan, olmesartan, telmisartan, and valsartan. Now you can also add a little note to the side, just putting down if the drugs in this particular drug class are a part of the most prescribed drugs. Depending if you need to learn the top 200 to 300 drugs, this is something that comes in handy when you've got tons of stuff to review before an exam, or if you're reviewing for your boards. You can quickly go back through your notes and pull out the drugs that are most commonly prescribed. And here again, a column or a place for formulation. So if you need to know if it comes in an oral solution or if it's available as a tablet only, then you can put this in your notes here. U stands for the mechanism of action. So this is basically understanding how the drug works. And the ARBs block the vasoconstricting and aldosterone secreting effects of angiotensin II. So students struggle with the RAS system, or the renin-angiotensin-aldosterone system. So I've broken it down for you so that it's very, very simple. Basically, this system regulates blood volume. It regulates systemic vascular resistance. And together, they both influence cardiac output and arterial pressure. And the three important components to this system, number 1 is renin, number 2, angiotensin, and number 3, aldosterone. So let's take a look at a pathway so you can better understand what's going on in this system. So if you remember, renin is an enzyme produced in the kidneys, and its responsibility is to ensure the conversion of angiotensin I. I did mention the bradykinin in the ACE inhibitor video, but I'll go into more detail in this ARB video. So bradykinin is an inflammatory mediator, and it causes dilation and it lowers blood pressure. So the ACE inhibitor comes in and inhibits this ACE enzyme. So what it's blocking angiotensin I from converting into angiotensin II. And this is really important when we're learning about the ARBs, because the ACE inhibitor blocks this enzyme further up in this pathway, whereas the ARB will block the direct effect of angiotensin II, and blocking angiotensin II will block vasoconstriction, and it's going to block the release of aldosterone. Now we want to block aldosterone because it increases sodium and it increases water retention. So therefore, if aldosterone is released, we're going to increase that blood pressure. Now, the benefit of the ARB working directly on angiotensin II and at the bottom of this pathway is that we don't see dry cough in these patients that are on an ARB as compared to the ACE inhibitor. Because it blocks this enzyme at this step, it more affects the bradykinin rather than the ARB. So the ARB is further away from bradykinin, it's further down this pathway, so we get the benefit of no dry cough, as well as the benefit of blocking vasoconstriction and blocking the release of aldosterone. So R stands for reviewing what the drug is used for. So this video series is reviewing hypertension medications. So we'll just take a look at the hypertension indication. In other videos, you can learn about how ARBs are used in patients that have diabetes and then also patients that have heart failure as well. S stands for side effects of the drugs, but I also like to add in contraindications and warnings in this section as well. So side effects that you need to remember for the ARB, think about the kidneys. It causes hyperkalemia. And we're going to have dizziness. Just because it is a blood pressure medication, we're going to see dizziness if it is added in addition to another blood pressure medication, if you are adjusting the dose, or perhaps this is a brand new medication that your patient is starting. They can experience dizziness in the beginning. So contraindication is very similar to the ACE inhibitors. We do not want to give it to our pregnant patients. We do not want to give it to patients that are able to get pregnant because it's very dangerous to the fetus. And we also don't want to give this medication to our patients who are breastfeeding because it can cause harmful effects to the infant. Contraindication again is similar to the ACE inhibitors because of where the drug is working, and that is in the kidney. So we need to not use it in our patients with moderate to severe kidney disease or in our patients with renal artery stenosis. Now, the warning behind the use of this medication in patients with moderate to severe kidney disease is because it not only increases the risk of further kidney damage, but also hyperkalemia. The risk of hyperkalemia further increases if patient is also taking a particular diuretic, potassium supplement, spironolactone, which is a potassium-sparing diuretic, and aliskiren as well. So we commonly see patients on a diuretic such as furosemide, and at the same time, they are given a potassium supplement to replace the potassium that has been lost from using furosemide. So this will put the patient at risk because it is a potassium supplement and the ARB by itself increases potassium. So this can cause hyperkalemia. I put this picture slide up here so that you can start to remember what's important to know about the ARB, warning and precautions. So always be thinking about the kidney, always be thinking about other medications that can increase potassium because of the risk of hyperkalemia. E stands for education. And we want to be sure that we discuss with our patient the really important points about this medication. So because the big concern with hyperkalemia that we have with ARBs, we are going to talk to our patient about eating foods high in potassium because that can increase the risk of hyperkalemia. Also, we want to talk to them about changing positions slowly. For example, if they're sitting for a while and they stand up suddenly, we want to talk to them about doing this slowly to minimize hypotension. Also, just giving them a heads up that this drug can cause dizziness. So they need to be really careful with driving or other activities until they really know how they feel on this medication. So I always recommend to have them start it on their day off or on the weekends where they're not doing too much. Also, remember that women of childbearing age should be on some sort of contraception because the drug is very harmful to the fetus. M stands for monitoring, and I also add in assessment here. So it makes sense that we want to monitor potassium, monitor kidney function, monitor blood pressure. And again, we want to assess the patient when they're sitting, standing, or laying down, looking for hypotension. O stands for outcomes, and this is really going to be based on why you're giving your patient the medication and what goal that you're trying to reach or what you are trying to measure. In this case, we're discussing medications used to treat hypertension. So our outcome that we're going to measure is a decrease in blood pressure without excessive side effects. Depending on what your goal is, so if you're using this medication for heart failure patients, then your outcome will change. And D stands for different, but I also add in different or same. And the reason why is because it's important to take a step back, review your notes. You want to pull out the differences or the similarities between the drugs that you are learning in the same drug class versus the drug that you are learning in a different drug class. So what I've done is that I've created a separate video to compare all of the medications that we use in hypertension to help you do well in the exam. That way you can really just pull out the key points and the key differences of the different medications that we use. So if you want to learn more, please subscribe to my channel. I do upload videos weekly. I cover all topics found in your pharmacology textbook. If there is a topic that you want to see, or if there's something that you're struggling in, put it in the comments below and I'll be happy to make a video for you. Thanks for watching, and I wish you the best.